Hello, I am Dr. Joshua Kaggie, and I am an MRI researcher at the University of Cambridge. The NIHR has helped my research and my research career by partially funding myself over the past few years, but also by funding other staff members that I work with. And so we have a research nurse that helps us recruit patients for our studies so that we can prove whether our techniques are effective. I am involved in imaging research at all stages. I may develop methods, and that includes even the soldering of hardware, of new experimental methods of equipment, and putting those into an MRI scanner where I'm often the first volunteer for those because it's equipment that I built. Um, but programming the scanners or doing a lot of analysis to see whether these methods are effective. And so I'm interested in showing whether some of these methods are effective in osteoarthritis and cancer. And so a large portion of my duties also involves recruiting and imaging patients. All of this working together to be able to give you a better clinical diagnosis, to be able to see what is healthy and where things aren't healthy, where things might be treated to improve your long term health. And that's very important.